Good morning. Welcome to this edition of the Lynne Hayes Freeland Show. Yes, social distancing is real here on the Lynne Hayes Freeland Show. As you can see, I'm in the studio all by myself, but I am wearing a mask, and I think I'm doing it just for effect because obviously there's no one here in the studio. But one of the reasons why I wanted to wear this mask today was because last week Dr. Gregory Patrick used the line, masking while black. And it stuck with me because it's part of the conversation I want to have today with my very special guest. We all know the term driving while black, but as we talk about the implications of COVID-19, the novel coronavirus, and the black community, masking while black is one of the things we're going to talk about throughout this next half hour. So sit back, relax. We've got a lot to do when the Lynne Hayes Freeland Show continues. Welcome back to this edition of the Lynne Hayes Freeland Show. I feel like for the next couple of weeks, we are going to continue our very candid conversation on the coronavirus and the African-American community, but from a variety of different perspectives. We're doing it all by Skype these days. Joining me today for that discussion is Dr. Larry Davis. He is the founding director of the Center on Race and Social Problems at the University of Pittsburgh. Welcome to the conversation, Doctor.
Thanks, Lynn. Great to be here. Thank you.
How'd you like that line, masking while black?
Masking while black. Yeah, that's appropriate.
You know what? But it's interesting because, and there's so many things I want to talk to you about, but I just want to kind of pick it up because we started that conversation last week. You know, all of a sudden, everybody's saying wear a mask. You got to wear a mask not to protect yourself, but protect other people. But for African-American males in particular, that's kind of a double-edged sword to wear a mask, isn't it?
Yeah, I guess there was some talk about that in terms of that they are already suspects. So wearing a mask is, makes things even worse. I'm not so sure though it's such a big deal because black males are already suspect anyway. So.
Okay. All right. So the other thing that I guess I want to get into is we've seen the numbers. We've seen the disparities. We have seen the striking numbers. We're still kind of waiting for this breakdown of numbers throughout Western Pennsylvania. But when we look at other cities across the country, we've seen striking numbers in the African-American community in terms of how we are being affected. Now, America is upset. America wants to know what's happening. Why are black and brown people being affected so dramatically when so many of the underlying issues and problems aren't new to us and they shouldn't be new to the rest of America?
That's right. That's right. Well, it's kind of, I didn't think of this before you started speaking to me about social distancing. Mm-hmm. But in part of the problem for black and brown people is that they have been social distance away. That we have been social distancing for us really is sort of not new. It's like the invisible man, so to speak. We're kept at a distance from the important things in society, better education, better schools, better jobs. So it's kind of interesting that in terms of a play on words, like driving while black or something. But this social distancing is kind of interesting here because that's why, in part, things are working out so poorly for us because we have not been included enough in the larger society. We have been largely segregated from it.
So I think I have been very frustrated lately because we talk about first responders, and certainly I am as concerned, as empathetic as anyone else about the fact that our first responders put their lives on the line every day. I think about the people in the hospitals. I think about our police officers, our firefighters, our EMTs. But I also think that our bus drivers, our maintenance people, our janitorial staffs, our grocery workers who work overnight stocking those shelves. There are a lot of other people who put their lives on the line every day too, but for far less money. And I don't think, and they're by and large Black and brown people who don't get the same recognition.
Or the same pay. That's exactly right. That's, when people talk about billionaires, we talk about them as though they earned the money independent of all the supports they receive. People who clean the streets, caretakers. Yes, that black and poor people in the country really have been doing these things forever. We have not been recognized, so it's not valued. It isn't valued work really in our society. I mean, we do it. That's why they think it's only worth $7.25 an hour. That's why they think it's. In fact, some places don't even want to hire that, and people resist giving a raise to minimum wage workers. No, the society doesn't. But it's nothing new that society has never valued Black people. Period. Really. And now, what you're seeing, I think, with the present health crisis, is really the status that Black and brown people have in America, that we're not cared for very well, and you don't notice it as much until a crisis like Katrina or something like this happens, where you can see who's harmed most. We are in these vulnerable positions that you talk about, and we are congested. We can't withstand. I always feel about Black people that it's like we go down the road in a car with no spare tire, and then when there's a flat, we have a crisis. Other people have a spare tire. We don't.
Right.
We're all in all the time.
And even when we talk about some of the underlying physical conditions, I mean, we talk about high blood pressure, diabetes, and I heard someone say the other day, well, of course, some of those things exist because we don't, in a lot of our communities, we don't have access to fresh fruits and fresh vegetables. We don't have access and those kinds of things and exercise that all lead to a healthy lifestyle. But nobody cares about those things until something like this happens.
Well, we do care about it, though. There people have been talking about this. It's come to light more in the last, 20 years, 15 years. Basically, people talking about social determinants of health, realizing that, segregation is a biggie. It's really, that's why distancing is kind of interesting, the term. I'm sure someone will take that and run with it, that we have been distanced from opportunity, from health. So now it just shows up when something happens, but life expectancy is shorter. Black women have higher mortality, infant mortality rates. So yeah, in fact, life expectancy, in terms of even infant mortality is much higher. So it's there all the time. This just dramatizes it, but people have been talking about social determinants of health now for some time. The dilemma is we're not quite sure how to solve it, or if we have the will to solve it, because it's basically part of the larger problem about segregating Black people from the larger society.
Well, I think the other thing that comes to my mind, Dr. Davis, is it's almost too like there are two parts of the conversation. Because I do think that there are some parts of this that we have to take ownership of. There are some parts of this that we have to take ownership of. So even though, say, we may not have fresh fruits or fresh vegetables, and sometimes we do make the easier choice for the bad foods, but we can take some ownership of that. We can take some ownership of not necessarily following up on the doctor's recommendations or I think there are some parts that we can take ownership of, but I think sometimes there are parts that the bigger society has to take ownership of too.
Oh yeah, I mean it's not equal. I mean, I go along with you and sort of say, yeah, okay, Black folks could do better than they're doing, as is true for white people too. But I think our behaviors, in that sense, are a small portion of the problem. I mean, the major problem is that, basically we have been systematically excluded from benefits of this society. Schools, jobs, neighborhoods. Some of the health stuff you're talking about were placed in neighborhoods or are only allowed to live in neighborhoods by, hazardous sites, dump sites, chemical plants. I mean, all these things, it's a massive problem, and then something like this happens and it comes to light even more dramatically. But it's with us all the time and people know it. Unless society, decides to really make a change, I think about this a lot, that, America really has to decide to make a change for something to happen. I don't think Black people can solve it themselves. I mean, I wish I could say, well, we could pull ourselves up by our bootstraps. We could be perhaps like the Nation of Islam or some group that we just don't have the wherewithal to do that. We don't have the wherewithal for money, for the resources, for businesses, for schools. We couldn't do it. We need essentially a Marshall Plan. America needs to do for Black America and poor whites too, what it did for Europe. It needs to come in and say, okay, we've really not done well by these people. And rather than just looking at each little piece of a problem as it comes up, let's really address the problem in a holistic function. So something like that is really, we can piece it together. People like you and I, we can help a little bit and we can get some kids in school, we can mentor, we can do some things. But the real problem will only be solved when America decides that they want to solve it.
Wow, and I want to pick up on that. I want to pick up on that, but hold on. We got to take a commercial break. I'm going to start right there in just a minute. When the Lynne Hayes Freeland Show continues, you know what that means? You don't want to go anywhere. We'll be right back.